Hi, I'm John, your host, and welcome to Heart of Care, a podcast by AMCU. Here, we delve into the real voices of healthcare, sharing stories of resilience, humanity, and the unwavering heart that drives it all. Join us as we empathize, learn, support, and even find moments to laugh together. Thanks for being here. Welcome back to Heart of Care. I'm your host, John from AMCU. This is episode 4 of Heart of Care podcast, Mental Health, the help we often delay. Today, we're talking about something incredibly important and often incredibly difficult, mental health. It touches all of us. We've seen it in friends, in family, and in our own lives, those moments when life's pressures become too much. Maybe it was grief, trauma, a relationship breakdown, or workplace bullying. Sometimes, there are underlying conditions like anxiety or depression that go unnamed for years. What I've noticed time and again is this: people push through until they just can't anymore. And often, it's only at that breaking point that they reach out for help. Mental health conditions vary, but broadly, we often see two groups. The first, neurodevelopmental conditions like ADHD, ADD, and autism, and the other group is mood disorders, anxiety, and sometimes psychosis. Regardless of the diagnosis, the struggle is real, and support is essential. The first person many turn to? Their GP. One of the most common questions we hear: can I get a mental health care plan? But what does that actually mean? Is it simple? Is it accessible? And crucially, is it affordable? Joining me today is Dr. Sophia, a GP who works on the front line of mental health care.
Thanks so much for having me, John. This is such an important topic. That moment when someone finally asks for help is so significant, and what happens next really matters.
Let's start with the basics. What exactly is a mental health care plan?
A mental health care plan, or MHCP, is created by your GP when you're experiencing a mental health condition that's impacting your life. It could be depression, anxiety, PTSD, OCD, ADHD, even early signs of psychosis. The GP will take a full history, assess your symptoms, and if appropriate, they'll create a plan that outlines the diagnosis or presenting problem, treatment goals, and referrals, most commonly to a psychologist. The MHCP gives you access to Medicare rebates for up to 10 sessions a year. You get 6 initially, then return to your GP for a review to access the remaining 4.
It sounds like a fantastic support system. But here's what people really want to know. Is it free?
Unfortunately, no, not in most cases. While your GP appointment may be bulk billed, psychologist sessions are usually not. Medicare rebates around $80 to $90, but most psychologists charge $150 to $250 per session. That leaves a gap of $70 to $170 out of pocket. Many people mistakenly believe the sessions are free because the plan is often referred to as 10 free sessions. But they're not free, they're subsidized. Unless your psychologist bulk bills, you pay the difference.
And when people can't afford the gap,
they're told to look for a bulk billing psychologist. But those are very limited, mostly telehealth, and waitlists are long, often 6 weeks or more.
And for those in rural or regional areas,
even worse. Fewer providers, less choice, longer waits, and often no local option at all.
What happens when someone needs to see a psychiatrist for diagnosis, medication, or complex care?
That's where accessing care becomes even harder, particularly through the public system. Public mental health services, community teams, hospital-based units, are at capacity and focused on people in acute crisis or with severe, persistent mental illness. Unless someone is in immediate crisis, actively suicidal, psychotic, or a risk to others, referrals from GPs are often rejected. The response can be they do not meet our criteria, or go back to your GP and get a mental health care plan. And this happens even when it's clear that psychiatric assessment is needed, something psychologists can't provide. There is a Medicare item, 291, for a one-off psychiatrist review to support GPs. But it's hard to access. It's not always bulk billed, and waitlists can be months long. And just to be clear, this isn't about blaming psychiatrists. They're overwhelmed too. There just aren't enough of them.
And how about for ADHD?
There's virtually no public service for adult ADHD. Most adults must go through the private system, which can be expensive. Many are paying around $400 per online consultation, and it usually takes 2 visits to receive a diagnosis. That's $800 out of pocket right there. After diagnosis, ongoing care typically includes follow-up appointments every 6 to 12 months for prescription management, each visit carrying its own fee. And many psychiatrists won't take ADHD cases due to the complexity around prescribing stimulants. Combine that with 6-12-month waitlists, and it becomes one of the most inaccessible diagnoses to manage.
Let's pause for a moment. If you or someone you care about is in a mental health crisis right now, what should you do?
If you're in immediate danger, call emergency services, 000 in Australia. For urgent but non-emergency mental health support, you can contact Lifeline, 13 11 14. Suicide Callback Service, 1300-659-467. Kids Helpline, 1855-1800. 13 Yarn, 1392-76. These services are available 24/7 and can connect you with someone to talk to and guide your next steps. Many states also have local mental health triage services.
It's so important to have these numbers saved, not just for yourself, but for those around you. Help can begin with a single phone call. For people not in crisis but struggling to access care, are there other options?
Yes, and they can be incredibly helpful. Australia has excellent, evidence-based online platforms. MindSpot, This Way Up, Mood Gym. Those are interactive CBT training for depression and anxiety. These tools are accessible, private, and available anytime. They're especially valuable for those in rural areas or those not yet ready for face-to-face care.
An important reminder, help doesn't always start in a clinic. It can start online at home, at your pace. And here's the real tragedy. People who are too sick to work, too poor to go private, and too vulnerable to advocate for themselves are falling through the cracks.
Exactly. They're told they're not sick enough for public services, but they're too unwell to function, navigate care, or even speak up. These are the invisible Australians, forgotten in policy, missing from waitlists, and unsupported in practice. Can GPs manage mental health? Absolutely. We do it every day. We are trained and capable of treating common mental health conditions, depression, anxiety, PTSD, grief, adjustment issues, and more. Increasingly, we find ourselves managing complex cases too, not because we're psychiatrists, but because there's often no one else. When the system falls short, we step in. We become the anchor, monitoring medications, assessing suicide risk, making safety plans, providing continuity of care. We do this in 15-minute appointments, often alone, often without a multidisciplinary team, and too often, without clear or timely referral pathways. GPs can and do provide mental health care, but we need better support, clearer pathways, and a system that doesn't leave complex care to chance. We care for patients with schizophrenia, bipolar disorder, PTSD, people who haven't seen a psychiatrist in years. We hold space, hold the risk, and try to hold them together.
To every GP, thank you. To every patient, we see you. To every policymaker, if you want reform, fund the frontline, and now is the time. So where do we go from here? Awareness isn't enough. We need funding. We need systems that don't just talk, but act.
Early intervention, better access, genuine collaboration, and above all, a commitment to listening, especially to those too unwell to speak for themselves. This is the first and most important step. We must begin an honest conversation and acknowledge the shortcomings of our current system. Without truth, there can be no meaningful change.
Thanks for joining us on Heart of Care, and special thanks for Dr. Sophia being here.
The pleasure is mine, John.
If this episode resonated, please share it. Keep the conversation going. Mental health care isn't a luxury, it's a right. Until next time, stay kind, stay present, and keep speaking up for those who can't. Thanks for being with us on Heart of Care. If today's story moved you, inspired you, or made you feel less alone, share it. We're building a space where we empathize, learn, support, laugh, and walk together. Subscribe, leave a review, and stay connected. And if you've got a story to tell, we'd love to hear it. Email us at amcu.media@outlook.com. Until next time, take care and keep caring.